In different parts of Kigali city, there are several residents seen being reluctant in following the set preventive COVID-19 guidelines. It is evident that some choose not to wear their mask in a right manner, avoid washing their hands regularly, and ignoring the social distancing rules.
These people cause problems to us. We stayed at home for more than 3 months because of people like this that do not follow instructions. And it's not good manners. I try to advise my colleagues to follow the COVID-19 guidelines.
For nearly a year now, youth volunteers have been at the forefront of the fight against the pandemic, monitoring and reminding the public to adhere to COVID-19 prevention measures, especially in crowded places.
Standing here at the bus park gate, I have to ensure that people are properly washing their hands. We also have to ensure that buses take only 75% of the passengers, which means 55 people on the bus. One can find at times those numbers increase. We interact with different people. Some can be very hard to deal with, but it is part of the job.
Dr. Menelas Nkeshimana, expert in infectious diseases, says that the prevention guidelines have had a significant effect toward the fight against COVID-19.
Back when the specific areas in Kigali had a spike in positive cases, we would test the residents in the affected districts. But now, we do not wait for them to approach us when they have symptoms. Instead, we go to their homes to test. That way, they can be treated before the symptoms worsen. The positive cases are then controlled to a certain number.
Dr. Nkeshimana says that no one should be complacent in terms of the pandemic because anyone can catch the virus. Dr. Sabine Sazimana, the Director General of Rwanda Biomedical Center, says that although some people have already been vaccinated, observance of the measures in place to fight the pandemic should be continued.
Dufite kimwe mu nyongera z'ibyo twifashishaga kurwana na COVID-19.
The vaccine is here to help with the fight against COVID-19. But it is clear it cannot replace the other things such as the preventive measures. However, for us to try and beat this pandemic by the end of the year, it requires us to be patient, and for those that did not get infected to continue adhere to the guidelines, and for those that got infected and beat the virus, they should also be careful because one can get infected more than one times.
According to the statistics by the Ministry of Health, so far 20,000 people have reportedly contracted COVID-19 as of March 12, 2021, and 18,000 have already recovered. The death toll stands at 273. GABBY MUVUNYI for RTV.